Welcome back to the channel. Today we want to talk about a rather sensitive topic, which is the major depressive disorder. I guess especially due to the pandemic, we all might feel depressed at times. But the difference between feeling depressed at times and the major depressive disorder is that this feeling of loss of interest and also sadness persists for at least 2 weeks. Let's look at some facts. So, when we're talking about epidemiology, around 160 million people are affected around the globe, which makes it the second most common cause for years lived with disability. The risk for developing major depression disorder at least once in a lifetime is as frequent as 15% in developed and 11% in developing countries. When we're talking about pathophysiology, it's the same for many mental disorders because the exact causes are not fully understood. It's likely, however, that it's a combination of different factors. One can be a change in brain chemistry affecting neurotransmitters, which are responsible for maintaining a stable mood. It not only affects their function, but also their effects within the brain and how they interact. And apart from the chemical side, there are really biological changes which can be observed. Hormonal changes, for example, during pregnancy or after giving birth, so postpartum, can also cause depression. There are other factors like the monoaminergic system, the circadian rhythm, dysfunctions involved in the immune system, and or the hypothalamic pituitary axis. Major depressive disorder is characterized by symptoms such as depressive episodes, which can be reoccurring and also occur only once, which is, not very common. In general, it affects relationships, work, and overall health. The typical sign that we all are, I guess, familiar with is the low mood, which includes all aspects of life, also those who were previously a source of joy. The individuals might feel guilty, hopeless, and also worthless. They feel fatigued, have a headache, and also digestive problems. Severe symptoms, which can include delusions and hallucinations, are also feasible. Some might also suffer from insomnia. They withdraw from previous social activities, and it's also possible that they start thinking or even attempting suicide. 800,000 people die annually due to suicide. This makes it the second most common cause of death in those between 15 and 30. It's also common to suffer from further psychiatric problems, which can be a generalized anxiety disorder, for example. Now, when we're looking at diagnosis, it's of course about a clinical assessment, but there's often a lack of trained staff, and they might underestimate the severeness of someone's mental state. There are actually specific guidelines and criteria for assessing the major depressive disorder, and as usually differential diagnosis is essential as the underlying cause can be also, for example, a bipolar disorder. There are various treatment options, most of which include drugs. One class can be selective serotonin reuptake inhibitors. Here you see the general principle, the schematic principle. And those have less severe effects than the classical antidepressants. It's actually necessary in most cases to try different medications or also a combination of more than one, as not everyone responds equally. Furthermore, it might become necessary to see a psychologist or a psychiatrist because they might find the underlying cause and find ways to cope with the situation. Some forms might be so severe that a hospital stay is required. So, mental disorders might lead to suicidal thoughts and ultimately also to suicide. So therefore, those diseases, even though they're not as apparent in some cases, have to be taken very seriously, and awareness has to be risen. This was a quick overview of this disorder. If you enjoyed this video, don't forget to give it a thumbs up and to subscribe to the channel to see weekly uploads on scientific topics, including medical ones such as this one. See you in the next video.